Hi, just want to remind you we are going to be having a webinar next Tuesday, that's October 22nd at 7 p.m. That'll be on everything you want to know about dental implants. So, for those of you who can't get to the lecture, and yes, we're going to talk about the lecture, on October 23rd at 1 p.m., we're going to have a great lunch, by the way. Come to the webinar. So, October 22nd, 7 p.m. webinar. October 23rd, lunch right here, 1 p.m., and we'll talk about dental implants. Good lunch. Look forward to seeing you. Now, why are we here? You're in a room you probably never have seen before. This is our headache therapy room. And we're going to show you a little bit about headache therapy. Why would you be seeing a dentist, of all people, for headaches? Well, a lot of the muscles that are involved in headaches have to do with the jaw. And who deals with the jaw? Dentists do. And so, for years, we've been working in ways to be able to help people with headaches. And one of the typical ways that we use is something called a splint. You see this splint. This is a flat piece of plastic where your lower front teeth can only touch this piece of plastic, nothing else. And what that does is allow your lower jaw to come to a neutral position rather than the position the teeth are guiding it into. See, if your jaw reaches a neutral position, that means the muscles are at rest. And your headaches may get better. But that, in fact, is not the whole thing. We've been doing these kinds of therapies for years. The more current method of taking care of headaches is not just to work with a splint, not just to work with something in the mouth. Because chances are you've been having headaches for a long time. You know what I mean. Pain in your neck, pain in the side of the temple, migraines, feeling of pain or pressure behind your eyes. All of that has to do with muscular pain. And that's been going on for a long, long time. And so while the splint will be very helpful in relieving the initial portion of the pain, the fact is these muscles and the nerves that are innervating these muscles have been fighting and have been firing for years. And so sometimes the splint isn't just enough, or isn't enough. So there are things that we can use, that physical therapists also use, to be able to help people. One, you've seen me carrying this for the past a minute and a half. This is ultrasound. What ultrasound does is to break up scar tissue. Why would you have scar tissue? Well, if you were involved in any type of injury at all, let's assume that you're involved in an auto accident, or maybe you fell, or maybe you were hit by somebody, or you were in a football accident, something like that. The muscle fibers tear, and when the torn muscle fibers heal, they heal in with a little bit of scar tissue. Well, muscle fibers will contract, and they'll expand, but scar tissue doesn't. Scar tissue is really tightly bound down. And so one of the things we use is ultrasound. Why? To break up that scar tissue so we can start to get healing to progress. The way it's being used, and we're going to use it on Lisa for a second, is that we place it in the areas of the muscles that are involved in headaches. The temporalis muscle is right here. I won't disturb Lisa's hair too much. We won't go on that one. But the masseter muscle is one that goes from the cheekbone all the way to the bottom of the jaw. And then there's the sternocleidomastoid muscle that goes from the back of the skull down into the neck and holds the head up. These muscles are really involved in some of these injuries, and the scar tissue is formed as a result of those injuries in those muscles. So with the ultrasound, we'll just take ultrasound, which is a method of delivering heat and which breaks up scar tissue to the muscles that are involved. So this is what we would do on the side of the face. We do the same thing on the side of the neck. And gradually the scar tissue is broken up and you feel better. So that's one form of therapy that's used. Another form of therapy that we will use is cold laser. Now, I know you think about laser as something you cut with, and we do use lasers in surgery, but a cold laser works to stimulate the immune system and blocks pain. And so we can use the cold laser in the same area where we use the ultrasound in order to start healing and in order to help block pain sensation. And we'll use that in the same areas. And we do that for minutes at a time. I'm accelerating it just for the purpose of the video. We use it for minutes at a time in order to help that. The third thing we use is something called microcurrent. Now I don't have that right here with me, but there is microcurrent therapy. And what's microcurrent therapy? It's a way of applying very, very light doses of electricity to those same muscles and those same nerves in order to be able to, again, reduce the pain sensation. Now, how long does headache therapy last? It ordinarily lasts anywhere from 3 to 4 months with weekly visits here. And what we're doing is gradually relaxing those muscles in the ways that I just described. But that isn't all, because while you'll be here for an hour, you have homework to do as well. And that means you have to undergo muscle stretches in order to make sure that the elasticity that we've gained at the time of the treatment visit is maintained. So yes, your home exercises will make a big difference too. And then finally, once all of the muscles are relaxed, then we check your bite. Why would we check your bite? Because the same nerves that innervate the muscles of the head and neck also innervate the teeth. And if the teeth are off, remember we talked about the splint, getting that jaw in a relaxed position, well, that may not be the same position where the teeth are. And so with little adjustments to the teeth that we use assisted by a digital device that's attached to a computer so that we're absolutely accurate, just doing some adjustments to the teeth can get the muscles relaxed and can get the jaw position and the tooth position in the same place. That way your headaches can be better. So if you have headaches, or you know somebody who has headaches, come in for an evaluation. Evaluation is extensive evaluation. You'll be seeing us for 2 hours or even longer. And we'll see whether you might be a candidate for this kind of therapy. Hope to see you at the webinar, October 22nd, or the seminar here, October 23rd at 1 p.m. Call our office 259-9980 to make reservations for either one. Thanks.